So welcome friends. So I am very glad to invite Dr. Rohith Chary, who I know since last December, and he got AIIMS as well as CML rank 1. Congratulations for this, and can you introduce yourself?
Thank you, sir. Thank you so much. I'm Rohit from Hyderabad, Telangana state, sir. Did my UG from Gandhi Medical College, and as well as I'm right now pursuing my post graduation also from Gandhi Medical College, the government college in Telangana, Hyderabad.
And I am like I still remember the day like I was just going through the messages. Like in last December first, you messaged me that you got qualified for the last INI, and
Yes, sir.
but you were still pursuing your final year. Then I told that next time you will get. Then you told that I have to work hard, and right now you are in rank 1. So it is
Yes,
really a
sir.
wonderful journey.
Yes, sir. I still remember initially, I think 6 to 8 months back, I had messaged you on Messenger actually. On Facebook, after seeing your videos, I was really inspired, sir. I started loving the subject even more, and I messaged you on Facebook actually. Then I asked for your number so that I could be in touch with you on WhatsApp, sir. And you are very student friendly as always, sir. You are very prompt. If I had any doubts, I used to just message you, sir. And even in your busy schedule, you used to take out time to clear my doubts, sir. I was very fortunate, sir, to have you as my teacher.
And I actually want to know how was your preparation, because there are two things. First of all, you were someone who has cracked a reasonably good rank, actually really fantastic rank in last time also and this time also, and you had not gone for any NEET exam also. So how was your fundamental preparation? Because right now also you are going to write your exam, your theory exam. So whether you are preparing separately for NEET and submit or the INI and or entrance examination point of view, and separately for your MD exam, or everything went in together.
Initially, obviously, in first year, it was all of work, and I didn't even have any thought. Second year, as I entered peripheries, sir, I was very open to any subject. Didn't have any specific interest towards anything. I thought I'll by the end of all the postings, I'll get a basic idea on what the subject and like how the daily life of the doctor is and all. And after seeing everything, and I used to love reading neurology. And even my free time, I used to actually like reading and knowing more about it. So at the end of second year, I decided I wanted to decide about the branch, sir. And then towards the second year ending and final year starting, I like did a bit of research and started finding out about the colleges, how to read, what to read. I saw previous interviews and previous topper interviews, and I got a basic idea on how to read. And, made my notes in my final year, and I had a general approach. I used to do everything, but towards the exam, I gave preference for neurology. Last session also, I was not actually prepared because I didn't do medicine half part, and neurology also had just like gone through like half or 75%. But I had notes, so last before exam also, I had just revised and went. Luckily, I just got a random answer, but this time. As theories are also coming up, I was in two states there because both of the preparations are very different to each other. One is completely writing an answer, and one is a completely different approach. But at the end of the day, basics are the most important. So I used to give my time for both. Last 2 weeks, I did exclusively for the exam.
Okay. So I knew that you were preparing for an INA SS because you wrote only INA SS last time as well as this time. So for INA, you need to have medicine stuff plus a detailed knowledge about the specialty subject, that is neurology. So for the amount of depth of knowledge you need to know for a specialty subject is a bit different from your MD days, because the questions keeps on come little bit in depth in neurology part. So what was your prime source of preparation and prime method of preparation for medicine as well as for neuro subject?
Yes, initially final year was all about reading general stuff. I used to watch videos. I had the habit of making my own notes always. and I used to go through Harrison's once I'm done with the topic, whatever I'm reading, so that I don't miss the important points, sir. So initially it was more about reading general stuff, sir. After giving last time's in ESS, I realized, sir, like neurology, they're asking very high level questions, sir. Actually, last
Yeah.
year was very tough, sir.
Very
So I
good.
realized because just Harrison, it is very essential to have basics covered always in any exam, but for especially in ESS, you need to have that extra. Thanks to your videos, I got that extra thing. I didn't had to study Bradley separately, sir. So you made it so comprehensive that it was very useful, sir. Like I had a good set of notes by the end, and I would revise everything.
So you had gone through the videos, and in the videos, actually, we had given a Marrow notes towards, I think, last year only it was ready. So whether it was useful or you followed your notes and add on to Marrow notes, or whether you prepared your own notes after watching the videos.
Yes, I made my own notes, sir. I didn't have any printed something. I just had my own notes, sir. I made down my
Yeah,
own notes. I always
that
had
is
the
not.
habit of
Yeah,
writing.
always that is actually good. If you even if you have a notes or Marrow notes or anything, you really create your own notes because your own way of each one's method of approaching things will be different.
Yes, sir.
So, and what about the MCQs or the Q banks and test series and all those things? How did it help you and recalls? Apart from this, I clearly know that to go through the recall sessions also is important because previous question patterns will help you a lot. So how did you go on through that? Because you will be in a final year MD medicine, you won't get much time like others who are sitting and studying.
Did my notes thoroughly, and then last 2 3 weeks I kept only for MCQ sessions, previous recall videos, because those are the high yield stuff you need to must do before the exams. So I marked out the important topics what they're repeatedly asking, and I stressed on them, sir. And at the end, that were very useful, sir. The MCQs and the recall videos, and obviously the grant tests in the end were very helpful, sir, to know the status of the preparation.
So the grantors, the videos, MCQs, everything you have used. And I remember, like, I was just going through your messages just before the interview. You had to give, I mean, you had given me a screenshot of, shot of one question and asked me one doubt about one of the questions which came in the option whether it is correct or not, about some thrombolysis or something. Yeah. And I mean, like you were also preparing for like there was stage two was there like you attended last time also this time also. So how was the preparation for stage two? And did you attended our stage two preparations?
Yes, last time I did not attend stage two, sir. I had just given the exam because I was not. So I this time I knew there was the 10 days gap, sir, for the interview and after theory after the MCK exam, sir. But I didn't have so much time because I had to prepare for theory also. So I planned out so that last 3 days I have given, sir, for interview. Last 3 days I made a set of questions what all was asked, some test topics or something. I made a note of that, sir, and I just went through and more of I did practicing, sir. Like more of in-depth theory knowledge was not necessary for interviews, sir. Like just the basic stuff what you see day to day. You just need to present yourself in a just concise manner better there. Luckily, my interviewer was very friendly, sir. I think lucky, but it went fine, sir.
Yeah, actually, we had conducted one session on stage two also, and actually in stage two you cannot expect the questions, but most of the times it is like last 2 years it is almost similar pattern. They were asking about some approaches, basic clinical approach plus some related things. That was the thing they kept on asking. And you were telling that you watched the videos, and there are actually a lot of videos in neurology because neurology is like I had put most of the things from Bradley and Continuum together, and plus other journals and updates because you cannot get extra exact updates nowhere in a single space in neurology because keep on changing. Even now there are new changes that's coming up. So which of the modules or videos did you like the most? Because some modules will be boring for you. Any other suggestions you want to make in the modules or videos or anything like that?
Uh, Suggestions? No, sir. I mean, it was just perfect, sir. Like I watched almost all the videos, sir, because I needed a in-depth perspective, sir, because can't sit and read Bradley the whole thing. So you just gave a good synopsis, sir. So I made my own notes and went through it, sir. And even some topics which you normally don't go through, leukodystrophies or very random genetic topics which we normally don't come across in Harrison in much detail, that you have given emphasis in the form of MCQ discussions you have uploaded, sir. So that was very interactive and it was very good, sir, to watch a video. I specifically all your videos are good, sir. I think if you remember last, I think 1 month back, some cranial loves videos I
Yeah.
think were missing,
You
sir.
only
So
requested me.
I just asked if, but thankfully you uploaded, sir, because last time also they had asked quite a few questions from cranial nerves, and also you have updated that also, sir. So thank you.
Yeah, actually, cranial, actually, initially I skipped and I reduced it because in cranial there's maximum 2 or 3 questions used to come maximum, and actually the Rakesh sir has covered few of it.
Yeah,
But we updated those and we tried to add on that also. And remaining, I think one more cranial, 1 or 2 cranials is remaining. That we will put in MCQ because I put in the like MCQ sessions. I designed like those don't need much theoretical stuff but
yeah,
need
yeah.
some factual knowledge. I kept those in the MCQs because the core subjects where you need to understand the concept I put in the theory, and it may looks big, but I felt like when you go in the first time and second time you go through, it will be much easier.
Yes,
That is
sir.
what I felt. And what about the medicine preparation? You did basically a Harrison, or you did you watch the videos of Marrow or something like that?
Yes, sir. I've watched videos from Marrow and made my own notes. And Harrison based, I've considered sir, medicine. I've not. I knew
Actually,
I wanted to get good grip on the Harrison aspects, sir. And I knew I had to do an extra thing for neurology. So other medicine stuff, it's usually restricted. It's usually clinical questions, sir. So clinical and normal day-to-day practice questions, sir, and from Harrison base. So I concentrated mainly on that, sir. Harrison.
so you primarily prepared for medicine from Harrison, primarily from Harrison, and you watched the neurology videos and even the MCQ part, which I discussed, like I think 10 hour discussion is there. That also you have watched. So, what do you want your next coming generation who is going to write, maybe your juniors who is going to write next time, that you will be an inspiration to them definitely from your medical college only. They can tell that our senior has got when he was about to write the exam, because I had a senior who got qualified for NIMHANS when I was about to write the exam. So we used to inspire by him. So genuinely you are going to inspire them. So what do you want to convey them, how to prepare and what to follow and what to do?
Basic, they should get the basics right, sir. Always not go for fancy stuff. But getting the basics and concepts right is the most important for any exam, sir.
Yeah.
First year, it is anyways. It is all about work and getting the clinical knowledge necessary, sir. Like normal works, and then from second year, I think it is ideal time, sir, to get at least oriented to other specialties and at least come to a conclusion what you like, sir. It shouldn't be a narrow approach from the start, sir. It should be very broad spectrum, and by at least I think after peripherals, it is better to decide, sir, before, like at least in final year, I think it will be better if you have an idea, sir, so that you can do the extra preparation, sir. That is what helped me, sir, because I was open to anything, sir, like medicine, wanted to try out everything, and I've sat and gone through, but in the end, I've decided that neurology is what always fascinated me, sir. So I
Yeah.
have chosen and started.
That is exactly right. Like, actually, that was what I meant through the videos also. Like knowing the factual things is anyone can have factual ideas. You just by heart it is okay. Anyone can make the factual questions right if you are revised in the last moment. But to get a concept in the last 1 or 2 weeks is almost impossible. Need to have a proper concept at least before the last 2 or 3 months. Then only you can run fast, otherwise it is very difficult. And actually it's really a proud moment for you to tell that you had qualified for the both INA SS exam in the final year before writing the exam, and you're going to AIIMS with rank 1. Really, really awesome. Awesome achievement.
Thank you so much, sir. I always had a dream, sir, of central institutes and all, but Yeah, I don't know. I never dreamt of it, sir. Actually, like in my UG days, I never really dreamt of it. I didn't even write the exam, sir, at that point in my UG times because I know it is not my thing. PG
Actually,
also, didn't. I didn't really try so hard, sir, because maybe I never had basic confidence in myself, and I didn't knew I could achieve such things. But I knew as I joined MD, I wanted to do DM and a central institute. That was my aim. I got
actually,
that.
actually, that was actually in fact good because I feel like it has to be like that. Like from you have to peak at a time when you know the subject properly.
Yes,
Because even I was the same. Like I don't know that whether AIMS I have to write or not. I thought that I won't get AIMS, so I didn't write AIMS even in my DM. So that happened like that. And our time that INA exam was not there also
yes,
because that is a separate institute. So you have to go around all over the Indian write all exams. It is almost practically impossible.
yes, yes.
Yeah. And what about your family? Who all are there in your family?
My dad, mom. I have my own sister, sir. She's married. That's it. So we are.
I had seen some of your photos on Facebook. So
Yeah, parents are really happy. Sir. I couldn't believe actually. Me and my mom went through the list and we verified it almost 15, 20 times because it is not believable only sir, to get rank one because I never got it in my life.
this is something which will be so much happy. I mean you people will be so much happy. You don't know how to express it because something which you are not expecting, but you are getting the first rank in the country, the prime institute. So that is something really awesome.
Yes, I didn't expect at all, sir. In the end, there was a lot of lag in the results also. I stopped seeing also, sir, after a point. I just happened to, in one of the groups, they had put the PDF, sir. Like, it was very sudden, but luckily it turned out to be good.
And actually, it was for all out there, all the viewers out there. It actually, I mean, rightful things he is telling. Like he was able to go through all the videos. He was able to prepare, having read for Harrison. He was able to prepare for his MD exam. So you need to have proper conceptual knowledge, especially in neurology. You need to have proper conceptual knowledge to answer questions because questions keep on changing, but the pattern or the core subject is not going to change. Rather than one or two factual things may change. The remaining things will be same. The same old age old neurology will be there. And if you have the basic neurology, you can crack any exams.
Yes, sir. In these sort of exams, it is difficult to predict. Sometimes they ask clinical oriented, sometimes very factual questions and very in-depth questions also. So I think you need to have a very mixed approach, sir. You clinical, very factual. Also, you have to by heart. Sir. At least before the exam, you have to go through the tables and also. But obviously, anyway, the core concept is most important. Your videos helped a lot to build very core good concepts. Sir. I'm very thankful.
Yeah, and it is actually very like you are so hardworking so that you could go to all the videos, including video plus Harrison plus some of the medicine videos, and you were able to make a notes and you were able to revise it. So that was actually really wonderful job. And so, congrats to you and all the best for the future. And I see a very proud neurologist in you, and you will become one of the you are going to be the country's top institute as a top candidate. So once again, congrats, hearty
I,
congrats.
I thank you, sir. I think the team of Marrow, sir, for helping me. Always very prompt in whatever queries I had, sir. I would also like to take a moment and thank my family, sir, my parents, my sisters. They helped me a lot. Very my close friends. Shivani was one of the main motivation. My close friends, Vamshi, they helped me a lot. It was very getting difficult, sir, to manage both, and it was difficult, sir, in them because I had theory. I have my theory coming up, and this it was very difficult to manage. But I know I had to do it at some point, so I just fixed my mind, and luckily it is done, sir. Hopefully, if I clear my MD exam, I will join.
You will also fly in MD exam also. And I interviewed many candidates, but I think that you are the first candidates to thank one of your friends, because that is actually a really good gesture for me. Because many times when you are, especially when you're doing the MD, your friends has to help you a lot, even not only for preparing but for everything, from seeing a case to adjusting your duties for everything. So it is really hats off you to give some thanks to them also. I'm seeing for first time someone is telling that.
It is very crucial, sir, because at the end, anyone who is studying that need to have the right environment, right support. Luckily, my friends, my family, they were very supportive, sir. So we very low times were also there, sir. I didn't feel like studying; it was getting difficult, but they helped me and motivated me so much, sir. So I'm obviously very thankful, sir.
Yeah, and from Marrow point of view, we are always ready to help our students, and we are trying to improve as well. That is why we ask for suggestions, like whatever new things you want, you can just, anything is in your mind, you can message me also later. That so that we are ready to make new ideas or new corrections, whatever new suggestions, any new things to be added or anything to be removed. You can give me a suggestion after the exam. Now, right now, you prepare for exam, you give us a suggestion. We will definitely consider that.
Sure, sir, sure. I don't think there's anything to change, sir. But if at all, I'll definitely it is, sir. It is like you are one of the most student-friendly faculty, sir. I always get very prompt replies and very nice replies. You all also wish me all the best before the exams, sir. Very little things, but yeah, sir, it matters a lot.
Thank, thank you so much. Keep in touch and do update after your MD exam also.
Sure, sir. I'll definitely do.